Happy Thursday night. We are here with two beautiful and very successful women. I am so excited to introduce them to you guys. I'm just going to go ahead and start. We have Dr. Lynda Dean-Duru. She's a board-certified pediatric laser dentist with over 25 years of experience, specializing in children's dental care, including those with special. Let me move this over to the screen so you guys can, it looks like I'm looking at you. Specializing in children's dental care, including those with special healthcare needs. She's the founder of Ashburn Children's Dentistry and a 2024 inductee into the International College of Dentists. Trained at the University of Benin, Howard University, and Children's National Medical Center, Dr. Dean-Duru holds certifications in pediatric dentistry, laser dentistry, and orthodontics. Wow. She has provided over $200,000 in pro bono care and frequently lectures on pediatric dental health. Dr. Krystle Dean-Duru is a pediatric dentist with over a decade of experience. You started at 12? Specializing in airway evaluations, craniofacial growth, and laser dentistry. She focuses on addressing the root causes of issues like sleep apnea and dental decay. A graduate of Columbia University and Virginia Commonwealth University, Dr. Krystle is a diplomate of the American Board of Pediatric Dentistry and a 2021 Incisal Edge 40 under 40 honoree. A co-leader of Ashburn Children's Dentistry with her mother, she continues a legacy of excellence. Dr. Krystle is a passionate educator, advocate, and speaker dedicated to empowering families and promoting healthier futures for children. Congratulations. This is incredible. And thank you guys so much for being with Airway Circle. Did I miss anything? How I do want to know a little bit of personal. Krystle, how did you decide to go into dentistry?
Oh, I mean, like you said, I was in it since I was 8 years old. And so I've definitely just seen how much impact my mom has made and how much fun she has. So I mean, I have to have fun what I'm doing. And so it's been a journey in seeing that you can still impact children and impact their lives and then still really impact yourself and have a good time doing it. So that was what promoted me to do it.
You must be so proud, Mama.
Yeah, I am very well.
This is incredible. All right, you guys are welcome to share your screen.
Okay.
And introduce today's topic. I am so excited to learn from you guys. And at the end, we'll do some questions. If you're watching this live right now, you're an Airway Circle member. If you're watching this on a Thursday, welcome. Thank you for being here and consider becoming a member so you can help us keep promoting airway health and collaboration in the field. Here we go.
All right. So today we are sharing a presentation, what we call Beyond First Latch, a collaborative approach to optimal health from infancy. So what if something as basic as breathing can impede a child's success? You guys know who we are. This is, again, just repeats. We've taken a lot of courses to be able to get here and be able to present to you all. And we are a mother-daughter team. This is us. This is me when I was a child. And we're here together presenting for you guys. We're very excited. A little bit about our practice. It was established in year 2000. We're located in Ashburn, Virginia, which is about 45 minutes outside of DC. We're dedicated to early intervention, focusing on maximizing the optimal growth and development for children. We are experts in laser dentistry, and we have been performing, or Dr. Lynda has been performing, oral tie releases since 2006. We believe in using advanced technology and evidence-based treatments for conservative and comfortable treatments for our kids. Our philosophy, which we love, which is why I got into dentistry and got into pediatric dentistry, is providing the smile care from the heart. We do really focus on proactive prevention to ensure long-term dental health. And we treat the whole child, not just their teeth. So we're looking at the whole child. We're committed to educating our parents and patients about dental health. And we love collaborating with our families and our healthcare providers to deliver the best care. Again, continuing education has been the basis of our career. We know that once you get out of dental school, there's so much more to learn because things go out of sync or things go out of style. And so being able to understand and learn from different kind of providers, researchers, allied health providers, it's allowed us to stay curious, seek root cause solutions, and look at the leading research in advancing airway health for our most vulnerable population, which are our small young children. And our why is very simple, but very powerful. We're here to help children reach their full potential. And as healthcare providers and adults, we have the responsibilities to create an environment that removes obstacles and allows kids to thrive, not just survive. And so we think that by improving their breathing, their sleep, and their growth, we can empower children to live happier and healthier lives. And we believe that every child has a unique and special calling in life. So we feel really honored to be a part of their journey towards a brighter and more fulfilling future. So today, what we want to, our mission today, just to kind of touch upon, because everything you're going to hear is about 6 or 7 years of information, but we want to try to learn how integrating osteopathic treatments enhances structural and functional outcomes for our patients. Comprehensive care for long-term health. We want to understand that critical role of ongoing care to prevent future issues like sleep disorder breathing, underdeveloped jaws, and dental crowding. And we want to explore the power of the multidisciplinary collaboration and being able to promote that holistic health for developing infants. So how did we get here?
And so the picture you see on the top left corner was me many years ago. It seemed like I couldn't recover from bronchitis. And 5 doctors later, actually, I was being treated for Lyme disease. The symptoms I was having, obviously, like brain fog, extreme fatigue, and just not being well, which got me so scared. I was afraid for my family, I was afraid for my practice, and of course, my children. And so in getting to that 5th doctor, she took one look in my mouth and she said, "You must have sleep apnea." Obviously, having been a dentist for a very long time, I was like, she must be crazy. However, I got the sleep test like she ordered, and she was right. I was stopping breathing 25 times per hour in my sleep every hour that I slept. So that's equivalent to moderate sleep apnea. My symptoms were severe, and I was put on a CPAP machine, and I got better. Imagine looking so sexy during the day and then having to go to bed looking like that beta. However, in trying to get that treatment finished, 7 years into it, the CPAP stopped working. My symptoms came back. And now my option was to have my jaws broken so that we could make more room for my tongue. I really didn't want to do that. So I started exploring other options. And in that time, it became evident to me that how well you sleep and how well you breathe is determined by how well your face grows. And looking at pictures of me at 9 months of age, those signs were there that my growth was not going to be optimal. And the aha moment became, I see children as early as 2 days old, I could actually help them grow differently. And that's what gets set us up on this journey of making sure the kids are growing to their best potential from infancy.
So one of our mentors, and should be everybody's mentor in this airway space, is Dr. Krystle Dean-Duru, who in one of his research papers said that and concluded that pediatric OSA in non-obese children is a disorder of orofacial growth. So this is where we come in. This is really important. And RIP, God rest his soul, he did pass away in 2019, I think it was about. And so, so there's more evidence that snoring and not sleeping well, or snoring is an evidence of not sleeping well, but snoring is not just something that is cute. It's not cute. Dr. David Gazal, a pediatric pulmonologist and expert in sleep medicine, had a study where he concluded that even as a when you're younger, when 3, 4 years old, if you started snoring then, those effects of snoring can actually affect you as a teenager, even after you stop snoring, and can affect your academic performance. They said that the findings supported that the concept of sleep-disordered breathing, neurocognitive morbidity may only be partially reversible, or that a learning debt may develop with sleep-disordered breathing during early childhood and hamper subsequent school performance. So even if you stopped snoring at the age of 5 or 6, that would still affect you. The fact that you were snoring would still affect you even as a teenager and affect you in your school, in your IQ. The Dr. Gilliman and his team also noted that in infancy, if you're snoring, it can lead to executive function issues at the age of 4 to 7 with neurobehavioral and neurocognitive consequences. So the neurology of snoring and the effects on performance, school performance, brain performance, neurological performance, that starts early on from infancy, and it continues to perpetuate itself, even if you're not snoring as a young kid. So that's really important. So we continue with more studies on snoring. Persistent frequent snoring from the first month of life is associated with lower cognitive developmental scores at the age of 12, by 1 year old. So it's possible that the deficit will continue to worsen with age. So these are 3 different papers, and there are many more that are out there that discuss the detrimental effects of snoring on the neurocognitive development of a child. So that's really important to keep note. But we don't want to ignore snore. How did we get here as dentists? Well, according to this image, and to many archaeological physicians, dentists, doctors, and anthropologists, they've been studying this, and they've questioned, are we developing the way our genes are programmed to be? And we're not. The things that are eating us, the things that we eat, and the things that we're doing are affecting how we grow and how our faces grow. And so there are different modern environmental stressors that are affecting us, that are causing our bodies to compensate and find different ways to adapt. And those different ways to adapt are causing soft tissue dysfunction. They're causing soft tissue dysfunctions in our faces and our airway health, which then, because muscle leads in form and function, is changing how our faces are growing. And so when our faces are growing in the wrong direction, that creates a wrong environment for our airway. And so then we start developing these airway-centered disorders. And we are here, this is where we are as far as technology. We're reactively treating these airway centers and disorders with CPAP, surgeries, cutting out things, taking out things, adding things that aren't really part of our natural development. So what if we start here and learn how to change our modern environmental stressors? How has our environment changed? What are the stressors? There's an increase in pollution and allergens in the air, which is decreasing the ability for us to breathe through our noses and creating an increased frequency of allergies and enlarged and inflamed tonsils. The way we're eating and what we're eating has definitely changed. We have more carbohydrates and sugars in our diets. Breastfeeding has slowed, and the feeding practices have changed. The introduction of baby formula and processed baby purees is also not allowing us to, or requiring us to chew, and giving less stimulation to our bones and less exploration of our oral structures, which is really good for our cognitive development as well. And then obesity has increased 300% since the 1980s. Things that we've made convenient for us, baby bottles, pacifier, sippy cups, bucket seats, and different devices, are actually not allowing our bodies to have the pressures that they should for growth and development. And so our muscles, our facial muscles are more active, and our tongues are less active. Our bodies are no longer as active as they used to be, and everything is connected. So things are becoming more difficult for our growth as we make things more convenient for ourselves as we get older. Nutrition is huge, and I constantly put this in our presentations because I'm always shocked and surprised to see that infant formula has sugar and corn syrup as part of its ingredient. So I don't know how a baby is going to be able to start out in life with having sugar as part of their diet in their food. So this is really difficult to see because nutrition is extremely important for us to be able to feed the right bacteria, feed the right muscles and minerals and things like that. And if we establish it with sugar, that makes things a lot more difficult. And so one thing and something to note about genetics, our environment shapes how we grow. So if mom has had dental treatments, things like extractions, retractive ortho, 4-by extractions, she's got sleep apnea or other conditions that are affecting her airway, well, that's also going to impact the baby's oxygen supply in the womb. And the baby's face reflects how their environment was. And so if they weren't nasal breathing, having tongue posture, proper tongue posture, lip seal, and chewing optimally, this is through life, then their craniofacial respiratory complex and the facial features are going to show that things were not optimal, which is why it's extremely important that early interventions focus on getting these functions right and develop the face as they should to truly represent the genetic potential, because our bodies come with old genetic driven or old DNA driven technology, and it's really the environments that affect how we're using them. And that's what's new. That's what changes. Again, the environment shapes how we grow. And this article talks about pregnant women who are snoring are likely to have have a higher risk of having infants who are considered small for their gestational age. So we have to realize that breastfeeding is like a superpower that goes beyond simply satisfying a baby's hunger. It is noted in multiple publications, but in this one, it said that children who continue breastfeeding for more than 6 months showed a lower risk of witness sleep apnea compared to those children who never breastfed or they breastfed for less than a month. So it's just saying that the act of breastfeeding, proper breastfeeding, actually helps to develop a child's airway. So.
And so many people may not know that we're born obligate nose breathers. And for the child to survive, they have to be able to suck, breathe, and swallow all at the same time. And many people may not even know too that by 4 weeks in utero, the tongue is already peristaltic. So it's already functional. And a tongue tie could be detected 12 weeks in utero. The other part that I didn't know until later was that the tongue was the second muscle group to develop right after the heart. Right after the heart, think about that. That's even before the brain differentiates. And for the time the baby is in utero, the whole body motions and sucking and other tongue movements, it's being practiced so that by the time they come out and take that first big breath, they're ready to go. Mm-hmm. And so we know how powerful the tongue is because it's connected all the way to the tip of our toes through what's called body fascia. We know that it plays a key role in chewing, speech, and taste, and also helps to shape the midface and influences how our airway develops. And because it's supposed to stay at the roof of the mouth, it's also influencing the basilar symphysis, where it goes directly into where the pituitary gland is and helps in releasing hormones as well. It helps to optimize those patterns which drive cranial motion and helping with lymphatics, with lymphatic drainage and venous drainage for the brain as well. And the compressive forces we get from it helps to stimulate bone growth adding and aiding us in facial and airway development. It helps to stabilize the jaw joint and helps to position the teeth to enhance the airway posture as well.
Olha que cena linda, captada.
So this,
Go ahead. No, you go.
so this is just a video, which we love to see, a little ultrasound and real time is that, or not ultrasound, MRI of an infant breastfeeding. And just you're able to see the mandibular movement with sucking, the palatal elevation, the pharyngeal constriction with swallowing, and the diaphragm moving with the breast, with breathing, and the milk entering the stomach. So breastfeeding is a whole body experience. And that's why we say it's used to develop the whole face, right? And used to develop the airway, because you're using so many different muscles in a coordinated fashion. And so as here as it describes the breastfeeding in the tongue, as the tongue and the nipple pushes upward, then you get transverse development of the palate, as the airflow through the nose then pushes also the palate downwards. So it's extremely important. And there's a balance of the muscles of the lips, the face, the lips, the cheeks, and the tongue. And that's extremely important with the motion of breastfeeding, which is why we say breastfeeding is more than just feeding, is actually a whole body experience.
And also, birth is our first body trauma, and not trauma like you go beat somebody up, but the process of coming and going through the birth canal is very important. And so, here you go. Next slide, please. And so from what we know from our colleagues in osteopathic medicine, this journal here is from them. It examines babies who were born between 6 to 72 hours after birth. And they found that over 95% of them had what's called condylar compression. And part of that is the part of coming through the birth canal and the compressive forces that occurs as the baby is coming out. And so what they find is that with that compression, you also have a lot of somatic dysfunction with it. And so over 95%, it was present. So most times people say, is that everyone? We go, yeah, most everyone. And even when you have birth from C-section, you can also have that condylar compression. So condylar compression, actually, factors such as are influenced by the somatic dysfunction that results from condylar compression, could also be by the maternal pelvic mobility, how long the labor was, and delivery method. And they all will influence somatic dysfunction in newborns. So it is important to know the birth story for every child, even as adults, because a lot of what happens then also affect optimal function of the newborn and leads the effective well-being into adulthood. So some of the things that could cause some more of that somatic dysfunction include extended labor with or without epidural or Pitocin. You also have rapid delivery, which means that the baby didn't have enough time to get all the normal forces that are necessary to have that suck, swallow, breathe reflex on board. They're having the C-section, having vacuum or forceps extraction, or the baby having cord wrapped around their necks. And sometimes you have a breech baby. So all of those will affect optimal functioning of the newborn. Again, some of that compressive forces around mostly toward the occiput, which comes out in 4 pieces when the baby is young and everything is still like mucousy in a sense, a lot of fascia present. And the very important nerves come from that area. They take the most brunt of the force during delivery. And some of those important nerves include the hypoglossal nerve, which is what supplies the tongue, and the vagus nerve, which goes to the heart, lungs, and the digestive system. There's also some compression that could be of the glossopharyngeal and the cranial nerves 9, 10, 11, and 12. So this becomes really critical for us as providers or dental providers to understand that not everything is a tongue tie. It could be a lot of compression so that the hypoglossal nerve is not functioning optimally to the tongue. Some of the signs that you would see early when there is occipitocondylar compression and nursing problems, difficulty sucking, difficulty swallowing, reflux or vomiting, spit ups, most parents say, and they go spit up is, they spit up just a little bit. Well, spit up is not normal. Consistent spit up in a baby should be investigated as possibly an occipitocondylar compression issue. And some of the things like colicky issues, respiratory issues, constipation, bloating, torticollis, or just a child who is totally uncomfortable and just irritable and able to console themselves.
So we like to say many things can wait, children cannot. Today, their bones are being formed, their blood is being made, and their senses are being developed. And today, or to them, we cannot say tomorrow, their name is today. So essentially, we gotta intervene earlier than later. And babies are not lazy if they don't feed well from the breast. There's always a reason what's going on. So how do we care at our practice? And what we like to call the care approach. It's comprehensive assessments through thorough evaluation and understanding each child's unique needs, using advanced therapies and latest technologies in treatment, responsive care and adapting to the evolving needs of each patient, because every child is different and every child changes, and then educating and empowering parents and children with the knowledge about their oral health. Very important to how we practice. And it starts early, as we've been describing, that the way your face grows is the way your airway is going to be affected. And that's through the functions. Breathing, swallowing, tongue posture guide the development. A newborn's ability to suck, swallow, breathe is extremely vital for their facial and airway growth. So when they're not able to do as such, that's when questions have to be asked. Chewing, as they get a bit older, then shapes the mandible. So being able to go from the proper suck into chewing is extremely important. And that shapes the face and shapes the jaw depending on how they're chewing. Form follows function, or they're interrelated. Form and function are interrelated. Suboptimal jaw growth affects breathing, as we know. So if there's poor jaw growth, that's going to narrow airway and make breathing harder, requiring more compensations and adaptations. And there's a critical period from birth to about 2 years old. And early integration of all these functions, the breathing, swallowing, tongue posture, sucking, and movement of the body is key to neurodevelopment. We're going to keep talking about the neurology because that's really what guides everything. When we care at our office, we're asking what brought the diet into the office, and we're asking a lot of these different questions about mom's symptoms and baby symptoms, and all of these are going to affect the optimal functioning of the newborn in various ways. And those things that happen in infancy, they do not grow out of them. This is what we typically hear, like, oh, they're going to grow out of it. They actually grow into other things, and they're felt and seen into adulthood in different manner. So what are some of the signs? What are some of the clinical signs of a compromised area that you may be able to see in an infant? And this picture here is Dr. Lynda, what she was talking about, that these signs could have been seen when she was 9 months old. She's got the clenched fist, the way that her neck and her head is turning to one preference. That open mouth posture is not just always a big open mouth, it's just even a little bit. And per my grandmother, she was inconsolable most of the time. So there were signs that were there, but of course, that this knowledge never was put together. Other signs that we could see are recessed jaws, the open mouth posture, drooling, torticollis, as we talked about. The pacifier use and dependency past 6 months of age that's a sign that the oral tie restrictions, the restricted oral tissues, the lip tie, tongue tie, and buckles, and then low tongue posture, deviated septums, high vault palate, and mouth breathing. Other things like reflux, projectile vomiting. Vomiting is not normal, and different head shape. and waking up for no reason. Those are some of the signs that one can see that gives a hint that something's up. Let's see. And in this paper, this was a paper done by Dr. Gilmano and his team, where they looked at, these were post-mortem pictures of children who passed in their sleep, and they noted different anatomical risk factors for narrow upper airway. And they're just saying that these things can be determined early in life, and things like deviated septum and asymmetry in the nostrils, they increase the airflow resistance, which don't allow for proper breathing. And so what else are we looking at? We're looking at the tongue. And so in this video here, you can see that the baby's, there's a mid-tongue restriction inside where the baby's tongue's not properly able to elevate. You see that dimple in the back there. And then here, this image here is one that we see more often now too. This is where it doesn't look like a tongue tie, but you can see the floor of the mouth pulling up. But here there's a wall of fascia. This is the kind of restricted oral tissue in the tongue that you don't want to cut immediately. This is where you actually need collaborative approach with your other providers, because this wall of fascia, as we know, tongue connected all the way down to the tip of the toes through fascia, this may mean there's tightening in fascia in other parts of the body versus just the tongue. So it's really important to be able to truly visualize what you are releasing by being able to have good and proper body work, whole body work before and after, or just before doing any surgery, of course. So you want to go through the roadmap?
Yeah, sure. And so for us, we have two phases of care. The first phase is a symptom resolution, which means that we're looking to get the baby on the breast or feeding well or resolving the original issues that the mom has. So part of our process is what we use, it's called the baby laser session. So we do a couple of those and also have the cranial osteopath take a look at them so that we can make sure, again, a whole body connection. We're looking at a whole baby, not just in their mouth or what they presented with. And then we do the oral release procedure. For us is a dual wavelength release, and we'll explain that in a little bit. And also, we want to restore function and keep function going. We generally have 3, sometimes more post-op visits after the surgical procedure itself. And by the second or third visit, we will give them a baby munchie, just something to help establishing nasal breathing and lip seal as quickly as possible. And then phase 2 becomes the part where we optimize their growth and development. So we're following up every 3 months with them. We're checking nasal hygiene, lip seal, and other milestones that the baby will be now growing into. Usually by the time they're about 6 months old or so, when they have started solid foods, we encourage the parents to get them chewing at that point, because the process should be milk, liquid to solid, chewing, not liquid to mush. And so we're always encouraging them, making sure they're doing that. Again, we know that chewing is what helps develop the lower jaw as well as other developmental functions. We also check the teeth that come in at the time. We check to make sure they notice start cleaning, start brushing, and then start flossing right away. And we continue the osteopathic treatment and baby laser sessions, as well as a munchie treatment. So guidance, first symptom resolution, and then phase 2 is guided growth.
And so the reason why we talk about it taking a village and collaborating is because there are other parts of the body that we aren't able, we know the head and neck, but there are other parts of the body which are connected that affect what we do, that need to be evaluated as well. Typically, babies spend a lot of time in one position in utero, and so they're going to have some tightness. And then we talked about the birth trauma, right? Everyone's got that. Everyone's got a bit of birth trauma coming out. It's normal, but it does cause some trauma to the body. And then when they're out of the canal, they're into other containers and other modern conveniences, and the lack of movement limits proper development, not just in the body, but even in the face and in the head. And we talked about birthing hazards in the modern birthing process. So it's important that we have our babies see different providers. There are different providers that have specialty in being able to understand what else is going on that could be limiting the baby, but then also allows for getting the baby ready for surgery. That is a traumatic experience regardless. So the baby has to be ready before and after for successful outcome and to have support. And like we discussed, many things can mimic a tongue tie. So it's not just a snip. And anyone who says it's a snip, that's a bad word. So note that. We do have multiple tools in our office, and mostly we do laser assisted and dual wavelength assisted laser therapy or laser releases and frenectomies. And we're going to talk about what we do. There conventionally, what has been used is scissors and the diode as instrumentation. Is not something that we look to have just because of the number of cons and may not be the best may not lead the best comfortable outcomes for the babies. So these are not things that we recommend at all. We do recommend using lasers to be able to do surgeries, and they have a lot more pros and a lot more ability to biostimulate and cause less damage to the babies than it does for not using these things. They are technique sensitive and expensive, but they are worth it. So keys to optimal results for releases: you have to have an infant care village who's going to give you the green light for surgery, a skilled release provider who's going through using the care approach, someone who is optimizing neuromyofunctional structure and function prior to release and after, dual wavelength release procedure. The use of baby lace is extremely part of our armamentarium, extremely important part of it. Post-operative neuromuscular re-education afterwards and growth guidance to establish nasal breathing and lip seal is extremely important, because for the baby to have had to get surgery in the first place, as we talked about, there were certain things that were practiced or not practiced in utero. So that means this dysfunction started way early. So it's not just a tongue tie. You have to follow the growth of the baby. Okay, we're going to go through a case really quickly.
Right. So, okay. So this is I would call him XH. And when he was 6 weeks old, when he presented to our practice, and the mom just wanted to know if he had a tongue tie that could be contributing to his loud breathing during sleep. The mom said that she had no discomfort breastfeeding, although she also said that she had recovered from mastitis, which usually just doesn't come unless there's difficulty breastfeeding. And she had had craniosacral therapy, but it did not help. This is her 6th baby, and he was born at 39 weeks at home after 8 hours of labor. He came in sunny side up with hands on his face and received Pitocin. Mom received Pitocin after delivery. Now we're going back to that sunny side up. Remember what we talked about coming through and the birth trauma. So you think about it, he came opposite how he should have come, with hands on his face. So a lot of trauma to his fascia. And her breastfeeding goal was to have up to 18 months. She did not have vitamin K shot at birth, but she was still breastfeeding. For the baby, which mom did not know was related, the baby was having frequent spit ups, frequent hiccups, wanting to feed all the time. Obviously, the mouth breathing, noisy breathing, and mom stated that he had a lot of milk on his tongue all the time. If you take a look at the baby here, you can see how far recessed his jaw is. So again, during that first visit, we did our care assessment. So first you take a look and you say, oh gosh, he's got that open mouth posture. Look at his posture as he's laying his whole body, and you can feel a lot of tension and the head preference and all of that. And we generally would check their reflexes as well. And inside, inside you lift up and you see the labial frenum, the maxillary labial frenum. A little tight, but not necessarily very problematic at this time, I didn't think. And then the lingual frenum, when you would not see it unless you challenged it, which means you have to push the put fingers back toward the tongue, and then the frenum shows up. But the biggest part is that the mom had said she did not want to have surgical intervention. So in planning for his treatment, we were like, okay, we'll do as many baby-led sessions as we can to see if we can improve the function. And then we'll have him see the osteopathic physician and make sure we have good nasal hygiene, put him on a baby munchie and watch his growth, and hopefully he will be okay. And so as the case progression, by the fourth baby lays, the lingual frenum became more evident even without being challenged. And also it was important to note that Dr. Tracy, who's the osteopathic physician, also noted that she couldn't move any further. The mandible could not get any further because of the lingual fetter. Obviously, the mom, we had to have her see that herself because in the beginning you couldn't see it, but during that exam at the fourth visit, during the baby-led session, I had her look because it was more evident, and even she recognized that, oh, this wasn't there before. So now you then have to now prepare mom for the surgical procedure. You always have to take into consideration the diet, sometimes a triad, because sometimes the dads are also involved. And so you have to always manage their own psychology to being able to take care of a baby who's going to have surgery. And this was at the baby-led section. This was the fifth one. And so many people are by now asking, what is baby lace? So baby lace we refer to as cutting edge without cutting. It's actually a non-surgical laser technique using laser light energy to target the neck, head, mouth, in our case, but you can generally use it all over the body. And is a specific laser wavelength, 1064 nanometer wavelength. It was developed by Dr. Derek Nordstrom and adapted for babies by Dr. Angie Tenholder. The most important things to understand is that there are specific delivery systems and specific sequence to this. And that's what makes it very powerful. That delivery system is designed for controlled dosing and consistent spot sizes to be able to produce reproducible results. Some of the things that we get from that is a fascial release, which means that it loosens up the hyaluronic acid of the fascia and helps to reconnect neurologically isolated fascial zones. It helps to get the restrictions and tension in the body much smoother, and flow is better, therefore enhancing blood flow and nerve functions through the body. It's not photobiomodulation, but the same kind of concept, but you kind of get a little bit of warmth to the tissues. And because of that the depth of penetration of that wavelength is able to also address and improve neural function. So it helps to optimize the nervous system. It helps us really in the tongue tie assessment. If you remember the tie that Dr. Krystle showed us earlier that seemed like a wall of fascia, when you have consistent baby-led treatment, the frenum restriction becomes evident because fascia can change shape, but the frenum that is tight or attached will not change shape. And it also helps with mitochondrial activation. There's just so many good things that happen with baby legs.
This just talks about the depth of penetration compared to other wavelengths. That's why it's really important.
Very well. So this again, this is another baby. Is that? Oh, okay, that's another baby just to show what we can do with baby lays. He was 17 days old when he came in. You can notice how tight it is to pull that tongue up. And by a couple of baby-led sessions, and before he had this frenectomy, you can see how much easier the tongue can go up. So sometimes that's all the baby needs. We can get the fascia release and the tension release, and they can get back on the breast and don't have to have surgery. And you notice up on the upper lip, the maxillary frenum, see how much easier it is to get his lip over to get to his nostril. So really important treatment. And then going back to baby XH, this was the day of the surgical release. We always do a dual surgical release, which is use a 1064 nanometer wavelength first to be able to loosen up the fascia and isolate the restricted tissue. And then we use either an erbium or a CO2 laser to do the surgical release. And the important thing to note is this is like immediately after surgery. And so we can go to the next slide. So in summary, he came in looking with his jaw very retrognatic. We were looking and doing all we could with osteopathy and the baby-led sessions, but the restriction made it impossible for the osteopath to help to bring that jaw forward, which we would have helped with him and his breathing. And when we did the surgical release, immediately after, his jaw was like went forward. So you could tell that restriction was gone, and then whew, the jaw comes forward. And this is like a couple months after for the post-op check. And by the time he was 6 months old, he was on track. So you see the lip on that line, you see the bottom jaw forward, and the most important part is that he was no longer breathing erratically. He was no longer having noisy breathing at all at home. So we continue to care postoperatively. Again, it's a growth guidance period, and we use a munchie. And again, we're looking to make sure we're continuing develop good functional development, good neurofunctional development, neuromuscular re-education, lip seal, nasal hygiene, and making sure that they're chewing on whole foods to help develop their jaws.
They're able to come off the nipple shield, and he's exclusively breastfeeding and doing great and gaining weight. Pain, once we get a nice good latch, has been wonderful. His sit up is much better, and everything has just gone in a great direction now. We're living the dream of exclusively breastfeeding.
Oh, that's so wonderful.
This is why we care.
All right, do we? I don't think we have time.
Yeah. Part 2.
Yes.
Well, if we had more time, we'd do more, but we do know now with everything that we have studied and every continuing education course we've taken to put the pieces together that as Maya Angelou said, do the best you can until you know better, and when you know better, you do better. And so this is something that this quote is resonating throughout everything that we all are learning. And so you just want to continue to do better with all that you know. And just a few key takeaway that mouth breathing snoring can start at birth and is a sign of a child needing help. There are neurological changes that can occur as early as the first year of life. So things like early childhood malocclusion, identified and treatment should be the cornerstone of our preventive efforts, just like we addressed early childhood caries. Obstructive sleep apnea or in children is a disorder of oral facial growth and function. And treatment requires everybody and requires a whole village. Dentists are crucial members of this team. So you want to be asking a lot of questions. You want to be bold. And the urgency of early screening and interventions at the first signs of development, malocclusion or snoring, things like that, there's no need to wait. It's really important to screen early and intervene early and not wait until a child is suffering from the symptoms. So we want to thank you.
Wow, wow, wow. Much needed talk. Thank you guys so much. This was wonderful. I have so many questions, and I want to invite anybody who's watching this live to also ask your questions in the chat box over here. and take a screenshot. Go ahead and take a screenshot. Make sure you guys follow. Are you guys on Instagram?
Yes, we are at our name, Ashburn Children's Dentistry.
Awesome. Make sure you guys follow them on Instagram. All righty. Let's stop the share so we can ask some questions. Perfect. Now I can see you guys. Thank y'all. What a beautiful beautiful work that you guys are doing together. Wow.
Yeah, thank you.
And coming from that, my main question is, how is pediatric dentistry changing overall? What do you guys think that the future looks like for a pediatric dental practice?
Well, I think, and I'll start us and then Dr. Lynda can go, but I think what is happening is the less of ignoring certain behavioral patterns, things that we just say, oh, they're just anxious, and starting to understand a bit more why, you know, a 4-year-old or 5-year-old is unable to sit still, or understanding why they're coming in, they're constantly sick. And just recognizing certain things that there were so many holes in our residency programs and teaching us, being able to just say, no, there's more to it, and try to sit with the parents and ask them more questions. So I think that's at least a start for pediatric dentistry and a change.
No, I'd have to say the same. And you know, in training, it's important for us all to also remember none of this is our fault. However, it's also good for not just pediatric dentists, for everyone to understand that what you learned in school by 5 years after, it's obsolete. So you have to constantly update your knowledge. And that means that being on the continuous education journey. And you don't all have to treat. You don't have to treat it. You just have to be able to recognize it or be able to ask questions. Okay, that doesn't seem normal. And we learned that the 2-year-old was grinding their teeth because they were stressed. And it always bothered me because they're not paying rent. What's stressing them out, you know?
All right.
Now we come to find out, yes, they're stressed, but it's not the stress the way we know of stress. They're stressed because their bodies are looking for answers. Their neurology is asking for help. You know, their neurotransmitters may not be up to speed. And just as we know it, it's not just size. It's mostly the neurotransmitter, as a matter of fact, because that's a newer research on sleep apnea. It's not just obstructive, it's mostly neurology and neurotransmitters, which means nutrition becomes extremely important. So hopefully with pediatric dentistry, we might get more nutritional education. We might even get some osteopathy, which really is the essence of life. We learned on cadavers, all the bones, everything was stuck and frozen. And we didn't know that the cranial bones kept moving up till 10 minutes after you expire. So all of these are concepts that cannot be in isolation. You've got to gather a village and everyone kind of share their knowledge. And for us being pediatric dentists, we see those children a lot more, even spend more time than even with their pediatricians. So critically important for pediatric dentists to recognize those signs even before the symptoms show up.
Wow. How old should a child come to see you guys first, and why? What can you do before somebody even has teeth?
Well, that's a really, really important question. I know from the Academy of Pediatric Dentistry, the guideline is that the child should establish a dental home by age 1. All right, that's all well and good. However, if that child has had any trouble latching, then tongue function, or there's some function that is not optimal. So I would say, as soon as you get out of the hospital and that baby is having trouble nursing, or whether you, mom, is feeling pain or not, but that baby is having any of those things that we talked about, you have to keep a knowledgeable pediatric dentist as one of those people who should see you. So some of the things that we can help them establish is one, good function, so we can have proper breastfeeding, not nipple feeding. And then we can also establish milestones. By 4 months of age, the brain is ready for the chewing reflex. And so that will be another provider that will help the mom understand why it's important to give the child whole foods, whole chewing food, have them get the meat on the bone, have them get a whole apple. It's just not nutritional feeding, there's experiential feeding.
Yes.
So all of that is very important as well for that
just the
child development.
education and being able to guide a parent to what provider they should be seeing, right? To quarterback essentially who should be around them as their village. That's in and of itself, I think, invaluable information. Yeah. So it's not that we're doing anything to the teeth. No.
Amazing. I did interview a functional medicine doctor one time, and he was mentioning how feeding starts whenever you look at the food.
Yes. Yeah.
You know, so long ago, that's where you start picturing and then touching and peeling and cutting. That's why it's so important to involve the kids in the kitchen to try to get them, you know, excited. But feeding starts all the way back there, and we're so used to just sitting on the table and having something put in front of you, and we expect the kids to eat, but eat it all, you know.
Yeah.
But that's very, very interesting. What preventive measures do you recommend for maintaining healthy airway development?
Well, first, again, it comes to function. Lip seal, nasal breathing, and tongue up, yes, and tongue up, and movement.
Oh, very important for kids. You know, you guys remember Dr. Martha Cortez?
Yes.
She was actually the host of Beauty of Breathing. It's our podcast now again. We brought it back. And she used to say or tell me all the time that one of the first things she would recommend to her pediatric patients was to do a sport. You know, what kind of sports are they doing? You know, it's so important for them to be climbing and jumping and running and being active. That movement that we take for granted, that is so, so important. How about, I had a question. Go ahead.
And no, we just saying we met Martha. Yeah. So we know how spicy she is. Yeah. She's cool. Yeah.
I know. She's one of my big mentors. I miss her dearly. How do you address oral habits, thumb sucking, pacifier use that could impact airway health?
That's a great question. And again, before I knew what I know now, if I saw them using a pacifier by past 6 months of age, I'd be like, what is this child still doing with this? You know, I'd be looking for ways to get the parents, okay, how do we stop this? You know, maybe put a sock, maybe do this, buy this and do that and do that. Now I have a lot more compassion, because now I'm asking, why does this child need a pacifier, one their thumb in their mouth at 4 years of age? So what you're looking for is trying to establish what's missing in their function and development and help replace that. So, and that's the idea of it, because then there's something is missing that you want to replace, and don't just go like cold turkey, get them, because then they develop other compensations and that.
Incredible. How do you guys manage anxiety in young patients during procedures like frenectomies?
Oh, so if they're unable, if it's high anxiety, of course, then we don't want them to feel, be traumatic or it be a traumatic experience. So sometimes we are taking them to, we have IV sedation in the office. We have things like nitrous oxide, and then sometimes it's maybe pausing and waiting and just having them continue their myofunctional exercises or their munchies and things like that until they're actually ready psychologically, and the parents are ready as well. So just using some of those modern influences to be able to help relax them and have a good experience is important. So
this has been great. Oh my goodness. Thank you, ladies, for spending an hour with us on Airway Circle. We are so appreciative of the wonderful insight you were able to share with us today. As a last thought, your last message, and how can people find you?
Find us. Well, we have our website, www.kidsmile.com, and then we have some really great lives and a lot of great information on our Instagram, and that's our Ashburn Children's Dentistry handle. And so, yeah, soon we'll have another, but we'll promote that on the Ashburn Children's Dentistry.
Oh, perfect.
Oh, and there's nothing wrong
yeah.
with that. Maybe by the time this comes out.
Oh yeah, so we're gonna be
watching this. As they're watching this, we may have a new entity. It's called Womb to Grow Wellness, and so yes, and that way we will be able to take more care of more of the patients and have them so they can think more. It's not just my teeth; it's my whole body connection. Yes.
100%. All right, last message that you'd like other professionals and patients alike to take from this.
Well, keep learning, keep curious and inquisitive, and get a hold of your ego. Get a hold of your ego as a provider and actually talk to other providers and keep an open mind. There are things that may have been mental blocks for you, and even if you can't explain it, does not mean that doesn't exist, and it doesn't matter.
Because you two are powerhouses. I mean, the amount of courses and things that you have accomplished, I am so impressed.
Yes, and then for moms, stay curious as well. Trust your hunch, trust your instinct. And when something inside you tells you there's something wrong or something is not right with your baby or your child, keep asking questions because God gave you that instinct for a reason. You are right. And then no, they do not grow out of it. They grow into other things and they may get other compensations that later on in life, your body just says, I'm done compensating, and you're going to have to address it at that time. At that time is a lot more difficult. Yes, I know that. It's a lot more difficult. It's much easier when they're younger. And many of them don't know that by age 5, 60% of the growth of your face is done. So you're really playing catch up by age 7. And so it's critical to get the foundation right before you start thinking about teeth. And that's usually Dr. Ben Morali is the foundation first, teeth second. And it's foundation first for so many reasons, not just the teeth. That's your neurological functioning for the rest of your life.
That was wonderful. Thank you guys so much. For Airway Circle members, thank you guys for supporting us and allowing us to bring these incredible webinars every single week to you guys. If you're not a member yet, please consider becoming a member so we can keep bringing these and we can keep maintaining our directory. Our directory is free for professionals to join. It is free for patients to find you. We have 25 to 3,000 visits to our directory every single month. So there are thousands of patients trying to find you. There are thousands of referrals being sent right there. And we want to keep offering all these wonderful resources for professionals and for patients. We love you guys. Thank you so much. Have a wonderful night.
Thank you.
Thank you so much, ladies. Bye-bye.
Bye.